I'm going to talk to you guys today about some of the misconceptions about physical therapy. Alright, so first one. If I go to a physical therapist, I'm going to get a massage, I'm going to get heat, I'm going to get pulse of the e-stim, and I'm going to get my back popped. Now, there's certain manual techniques that we do rely on, especially early on if they're necessary. So sometimes it includes massage, deep tissue work, joint mobilizations where we have to help a joint move better with manual techniques. And yeah, occasionally manipulation or popping of a certain joint if it's necessary. But that's not all there is to physical therapy. A lot of it does include, and the majority of it will include, a lot of active participation by the patient, which includes a lot of exercises. So that brings me to my next misconception of physical therapy is only strengthening and stretching exercises that I can do on my own at home or at the gym. And no, not exactly, okay? Certain exercises are going to be familiar whether you've had physical therapy before or not, whether you're familiar with exercising or not. Certain things are going to seem very simple and it's like, oh, I can just do this on my own at home. But no, we need to make sure that you're doing them correctly. They're all specifically based on why you're coming to therapy for. Basically, from the evaluation, when we gather and make the plan of care, what we need to be working on to get you feeling better, but to help you function better. Okay, so we have to work on those exercises specifically for your problem, but then also we could then progress them. Okay, so they're not always going to be the same. Third misconception: physical therapy is going to be painful. Now, is there certain discomforts with therapy? Yes, especially if you're getting recovering from an injury, if you're recovering from surgery. In order to get your mobility back, your strength back, certain things are not always going to be 100% pain-free. But as therapists, we are trained to gauge your level of pain, to gauge how your pain is changing, how your symptoms are changing, so that we can adjust the treatment program to how your symptoms are responding. Okay, so it's not always going to be just this gruesome pain. Okay, it's just some discomfort that's expected. Okay, so the next misconception is physical therapy is only for injuries, surgeries, if you had surgery, or if you're in pain. Yes, we see all those patients, but you don't always have to be in pain to come see a physical therapist. If you're having trouble with some sort of movement pattern, some dysfunction in your just ability to move, to do a certain task, or balance, okay, we do treat a lot of those other issues. So it's not just if you're having pain that you can't come see us. You can come see us absolutely if you're having trouble with just any other movement-based activity. And then lastly, let's say you come to physical therapy and you're better, you're able to return to certain things that you were able to do before, and you get discharged. Okay, and the misconception is like, oh, I finished PT, I'm good to go, I'm 100%, I don't have to think about this anymore, well, the problem that I used to be experiencing. Not exactly. Part of the big emphasis of physical therapy is also teaching you how to maintain the certain improvements that you obtained from physical therapy. So we will give you specific exercises that you have to continue with at home to make sure that you're maintaining what you gained, and then also being able to manage certain symptoms that you need to manage on your own at home. So we need to teach you guys, and we do teach you guys a lot of that as well. So it's not just I'm discharged and I'm good to go and I don't have to think about this anymore. You will have to continue most likely just to maintain what you gained.